What do you say we bring him in? Talk some sports medicine. Always look forward to our weekly visits with Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Good morning, Joe. What do you have for us?
Hey, Ray. We're well into spring sports now, coming down the home stretch, actually. And I haven't given much love to track athletes, and they're some of my favorite in a career of 30-plus years of getting to see athletes. They're unique. You see a variety of different sports, so they're really a lot of fun. And they start out in that darn rain and cold, and usually by the time we get to May, which is today, we start having their day in the sun and for the league meets and the state meets and all that kind of stuff. Usually we have a lot nicer weather. So I looked at a couple of articles, though, about it, and it is fun sport because you see a variety of different injuries. About 30 to 50% of injuries in a couple of studies I looked at are overuse injuries, Ray, and these are typically in our distance and our middle distance runners. We see stress fractures in the foot or the shin. The ones that are really concerning are in the hip, and they're hard to pick up. So stress fractures are a big part of some of our endurance, the distance people. But the number one injuries consistently in the studies that I looked at in track are in the sprinters. And in the sprinters, Ray, they include the jumpers, the long jumpers, the high jumpers, and the hurdlers. And the hurdlers are really a unique group. It's a small group, but it probably is our number one biggest percentage of injuries are hurdlers. And I found that to be the case through a career of seeing athletes. It's a tough activity. You got to be tough to be a hurdler. And we see some of the hurdlers with a lot of the different pulled muscle and strain and other issues that they have that I'll talk about in a second. But in track, about 80% of the injuries are to the lower leg, 85%. Only about 15 to 20% are in the elbow and shoulder. And, of course, that's in some of our throwers. We see that a little bit more in pole vaulters, and now a little bit in that the track athletes, like everybody else, lift weights. So we see that a little bit more. But the majority of injuries are going to be to the lower extremities and the legs. But getting back to the sprinters, the hurdlers, the jumpers, there's one big misnomer, mistake kind of that people looking at injuries look at is not understanding the difference between stress fractures, which you and I have talked about a lot on this show through the years, and an injury that is really common in track and sprinters and explosive athletes, and that is what's called an avulsion fracture. That's one of our tricky medical words. Avulsion means pull-off fractures. And these people, when they're running, these strong muscles will pull off a chunk of, typically it's the growth plate, and they will almost universally hear a pop. They almost always come in with a pop, and they come in on crutches or a wheelchair. They can barely bear weight. They're really weak and painful in one local spot. And typically they've been told by a lot of other people, oh, that is a pulled muscle. You pulled a hamstring or you pulled a quad or you pulled a groin muscle. But that's not the case in our high school kids. We very simply don't need a big fancy workup with MRIs and stuff. We get an X-ray, and we see these growth plates that are pulled off of the bone, and they are called avulsion fractures. And I've seen a career full of these, and this is the time of year that we get them. And a couple things about them that are unique. You can pick them up on X-ray, so you always get a chance to see them. And if they follow a plan of rest and rehab, they almost all recover within 4 to 6 weeks. It's just been amazing to me throughout my career how nicely and quickly they recover. But if they have it in May, they're not going to be ready, unfortunately, for the league meets. If you're going to have an avulsion fracture, usually earlier in the season is better, but they feel and hear a pop. They have an X-ray that shows a pull-off growth plate, and they have significant weakness as they hobble in the office on crutches and things like that. And so a big difference between what people get mixed up sometimes between stress fractures, which is from over and over again, those 2 miles that over and over stress, to these avulsion fractures where you're trying to really come out of the blocks as fast as you can or jump over the hurdle as fast as you can, and you feel a pop in a localized area. So one of the big things for us in sports medicine is knowing the difference between stress fractures and avulsion fractures.
Joe, what about the recovery for both of those? Is one longer than the other?
It depends on where and in which bone, but it is so universally how well the avulsion fracture kids heal. It just amazes me in a career of 30-some years. They all come knocking at my door in a month, 4 to 6 weeks, and they are much better, and I test them, and they are better, and I take them in the gym and make them sprint and cut, and they are better. So the avulsion fractures actually heal quicker in many cases than the stress fractures do.
All right, Joe, anything else you wanted to add, or does that cover it, my friend?
Not too much else. Enjoy coming down the stretch of some of the playoff basketball games.
Mm-hmm.
Kind of an odd injury, seeing a coach get injured on the sidelines. Was that a little bit of a strange one, Ray?
That was. He toppled down. I see he got the game ball from the players, though, after the game.
I'm glad he got the game ball, and from what I hear, it's a PCL, and so that's that injury that I talk about occasionally every year, where it's the opposite of an ACL. It's a hyperextension. It doesn't usually need surgery, and people do a lot better with PCLs than ACLs. But boy, that's really giving up your body for the game, isn't it?
It sure is. That's for sure. Joe, great stuff, my friend. Always enjoy the company with you on Wednesdays. We'll do it again next week.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us